Well, welcome to another episode of PCFA TV. It is great to have you joining us for this webinar from wherever you are. My name is Katie Clift, very pleased to be representing the Prostate Cancer Foundation of Australia today for another important discussion with a very esteemed panel that I'm very excited to introduce you to in just a moment. Today's important discussion centers on incontinence after prostate cancer surgery. And today's webinar actually coincides with World Continence Week. We know that for many men that are treated for prostate cancer, continence can become a very serious challenge. Research shows us that up to 80% of men will experience some level of incontinence after a prostatectomy, with some men also experiencing urinary issues after radiation or focal therapy too. But the good news is there are options to treat it. And today we're going to take a deep dive into incontinence and the treatment options available, along with how to manage your mental health and your well-being when experiencing this. So I'll turn to my panel. Very honored today to be joined by PCFA prostate cancer specialist nurse Kirsty Tonkin, prostate cancer survivor and PCFA ambassador Nigel McBride, and Karen Fuller, the services marketing manager at TENA, a brand which we are very proud to partner with each year to support men and families impacted by prostate cancer. So let's get started. We're going to look at some of the details of incontinence, what's available for men. Kirsty, let's start with you, and perhaps let's start from the very beginning. What causes incontinence issues after treatment? How long typically can they last for men?
Thank you, Katie. Incontinence issues can occur after prostate cancer treatments because of the location of the prostate in the body. It sits just below the bladder and bladder neck sphincter, the muscles that close the bladder. It surrounds the urethra or the urine tube, and it sits just in front of the bowel and rectum. And these prostate cancer treatments may cause damage to these structures and the muscles and nerves that help control continence. For many men, this damage can be temporary, improving between 1 and 6 months after treatment, but for a small number of men, it can be longer lasting, up to 12 months, or for a few, it may be permanent.
Thank you for giving us that information right off the bat in terms of explaining what it is. I know for many men, obviously, experiencing this, it's a frightening thing. It can be very confronting. Let's talk then about some of the key ways that men can manage it if they experience incontinence.
Sure, there's a range of continence products that can be used. Most commonly, pads are often a simple and effective choice for everyday management of incontinence, and Karen will likely be able to speak more on this. Other products that can be used, such as urinary sheaths or uridomes, which are a condom-like drainage device that drains urine into a bag, or a penile clamp, which gently squeezes closed the urethra or the urine tube, preventing leakage, but these can only be used for a short period of time. Pelvic floor exercises before and after prostate cancer treatments can help prevent and improve the recovery of continence. And the pelvic floor is a group of muscles that stretch like a hammock from the pubic bone to the tailbone, and they can support the control of urine and feces and wind. And these muscles are particularly important for when the sphincter muscles have been affected by treatment, such as with having surgery. Occasionally, further investigations with a urologist may be required for men who have issues with longer-term incontinence. And these investigations into the function of urination or the pattern of incontinence can provide a better understanding of the mechanism that's causing their incontinence, and potentially allowing options like medications to reduce overactivity of the bladder or improve urine flow, or with surgical interventions such as an internal sling or an artificial urinary sphincter. The internal sling uses a surgically inserted tape under the urethra or urine tube to lift and provide some gentle pressure to prevent urine leakage, whereas the urinary artificial sphincter mimics the natural action of the urinary sphincter muscle that was present and functioning prior to treatments. And it uses a small cuff that wraps around the urethra or urine tube, and it gently squeezes and can be deflated to allow urine to pass by pressing a small pump that sits within the scrotum.
There's a lot of different options that are available. Karen, let's talk about products. I mean, TENA has been a very valued partner of PCFA for many, many years. You are the leaders in terms of male and unisex continence products in Australia. Let's talk about your product range, maybe some advice when choosing the right products.
Well, thanks, Katie. We are actually very proud to be sponsors of the PCFA and all the fantastic work that you do. But as you can see on the screen, we do have a product range designed specifically for men. The design is like a cricket box, so I'm hoping that you can see that, in these white ones here. And so a lot of Australian men would be used to the size and the shape of that. It is designed to fit the male anatomy and to be discreet and comfortable. And it begins with our black one, which is actually a little bit hard to see on this background. That catches small leaks that can happen when you move suddenly, cough, laugh, or sneeze. And we also have washable boxes that feel like your normal underwear for light leaks. And these can be fantastic to just feel like you're wearing normal underwear, but you know that you're going to be protected for just those little light leaks. It then progresses into our pants range. So you can see there's a couple of pad absorbencies, and then it progresses into our pants range, and they are for a higher volume loss. The pull-up pants range comes in a navy blue colour and a white and grey stripe, and they're just a little bit different in absorbency, but they both hold up to around 1 litre of fluid comfortably. The thing to note is that your bladder will typically hold around 600 mils of fluid. I think a lot of people do not know what their bladder holds, and you don't know what you void, but you will standardly void around 300 to 400 mils, depending, of course, on how much you're drinking and also how much you are leaking. But the TENA products are designed to hold multiple wettings, and I really want to make that very clear. A lot of people do try to change their pad as soon as something has leaked into it. And of course, depending on the size of the leak and the size of the pad or the absorbency of the pad that you've chosen, it's actually not necessarily required. So if you match the absorbency to how much you're leaking, you could actually have an 8-hour use of each of those pads. And that is because the products draw the fluid away from the body and they lock it into what we call superabsorbent polymers. And we have multiple layers to our pads. Some pulp in there to hold urine, but also those superabsorbent polymers that lock away the urine, but also they lock away the odor. And that's actually quite important as well. So when you are choosing your products, you just need to consider how much you're leaking. Is it just little bits and pieces when you are coughing or sneezing or moving around, but also how long you're going to be out for. You might need a higher absorbency if you have not got the ability to change when you fill that pad. But also it's got to be what you feel comfortable in. So I just want to talk a little bit about an experience I had with my dad. And in fact, this slide has been built with what his experience was. After his surgery, and many of you will be familiar with this, he had no control once his catheter came out. So thankfully, he has me for a daughter, and I took along our grey and white striped pull-up pants in the hospital. And those of you who've experienced it, they made him drink 3 litres of fluid over, I think it was about an hour. And he wasn't allowed to go home until he had expelled quite a lot of that. But because he had no control, he was even on the way to the toilet leaking. We also then had a 1-hour drive to get him home. And these products kept him dry that whole period, and he just felt so much more comfortable. And then post that, he was then very good at doing his pelvic floor exercises. Got to tell you, first time in his life I think he's ever done what he was told to do, but this time he did. And he slowly moved down the range, ending up in the protective shield. So he started up here. He skipped this pull-up pants, but then he moved into these smaller shields, and he was just on the black one. Now, recently at Christmas, he was not well, had to be in hospital due to some blood clots, and he did actually experience some leakage again. But again, once he got better and was doing his pelvic floors, he could move out of the pads again. And so, it definitely is not, it's not out of the realm of possibility that you can actually bring yourself to wearing no pads. It's not possible for everyone. But if you follow your health professionals for advice as well, it can work really well.
I think that's really important, and what a great overview and visual to give us in terms of those options that are available. But as you say, and as we can see on the slide, being able to move down an absorbency and change it up as the patient journey unfolds. So thank you so much. We'll dive into more details in terms of TENA and what's available for men. But I want to turn to Nigel at this point. You were diagnosed with prostate cancer in 2022 and experienced incontinence after surgery. Maybe tell us a bit about your experience and what helped you to manage the issue.
Sure. Yes, my prostate was removed in June 2023, but a couple of months before that, I was referred to one of the nurses at Moorabbin Hospital to do pelvic support exercises. And I didn't realise at the time how important they are to prepare for the surgery and post-surgery. And I visited her quite a few times. We practiced and practiced until we finally got it right. And also after surgery, just a follow-up visit to see if I'm doing the exercises correctly, and I was. Straight after surgery, I was probably using 3 pads per day, mainly because I like to exercise and I like to walk around a lot. So, of course, when you walk around shortly after surgery, you tend to leak a bit. At the worst case scenario, I had going through 4 a day, but then it tapered off to 3, then eventually 2, then 1. And after 6 months, I was eventually wearing no pads. But I can't stress enough the doing the pelvic floor exercises helped so much for me in my recovery. Occasionally I do get leakage here and there, but it only happens when I'm at the gym where I do an odd exercise and where it's virtually impossible to practice my pelvic floor exercises doing some of those exercises. So that's okay. It happens once in a while, but fortunately now I no longer need to wear a pad, and those TENA pads, as you mentioned, are so great. Started off using the maximum pad and went down to a shield at the end. Terrific product.
I think also it's quite inspiring to hear your story too, Nigel, because a lot of men maybe aren't sure how to start speaking about the product, aren't sure how to prepare for the surgery or the symptoms. So, just having your advice and understanding how you kind of went through it is really important. What other, I guess, pieces of advice come to you top of mind for men who might be going into the surgery, or this could be a risk for them in terms of how to prepare?
I had a great opportunity to meet up with that nurse prior to surgery, and not only physically it prepared me, but mentally it did as well, because she said that this is going to happen after surgery, just prepare for it. I think that's the mental challenge with most men. They just don't, it's the fear of the unknown, but if you've got someone with you to guide you through the process before and after surgery, the recovery mentally and physically is so much easier. I can only suggest to men to try and meet up with someone to do those exercises before or when you have a date to get surgery done. And post-surgery, still do the exercises on a daily basis. It does help in the long run. Yeah, you might have some pads, have to wear some pads for a month like I did, but eventually it'll taper off and you get to the stage where you don't have to wear one at all.
This is a really important point as we segue to talking about the emotional health and mental health and well-being, because it's such a big component, as we say, of the entire prostate cancer journey, from diagnosis through treatment, through post-treatment, and what it looks like in terms of cancer survivorship and managing these symptoms after prostate cancer diagnosis. We know that men diagnosed with prostate cancer face it's a 70% increased risk of suicide. There's many factors we know that contribute to that. But I think your point about managing that emotional stress and lifestyle changes as well are really important for us to focus on. Karen, let's talk about lifestyle in detail. I mean, physical activity, we've heard from Nigel, again, very inspiring in terms of staying on those exercises, being really kind of driven and focused in terms of the physical activity component. But if men have practical concerns about how to deal with different everyday lifestyle activities, what would your advice be to them?
Yeah, look, many men everybody, women, men who begin to experience leakage will understandably begin to change some things like exercise, drinking, and outings. What's great about our lighter pads is that they are individually wrapped in a blue outer cover. So if you are out and about, you can actually keep the cover with you and wrap the used pad in that cover, because that's often the concern is, what am I going to do with the pad if I have to change it? How am I going to take a spare one with me? And so you can cover it and pop it in the bin in the toilets. We also understand it's harder for men, that you don't carry a bag around. You don't have bins in cubicles like women do. But our male pads are actually small enough to fit in your back pocket and be quite discreet. It could actually just look like a wallet in your in your back pocket. But I think the big thing to remember is that if you restrict the amount of water that you drink, so you might not want to exercise because you might want to have to drink, keep yourself hydrated, and then that's going to cause a leakage. But you actually could be making the problem worse by restricting your water intake. And that's because the urine in your bladder is more concentrated if you're not drinking enough. And that irritates the lining of the bladder. And Kirsty could probably speak a bit more to this if I'm getting it slightly incorrect. But then if the bladder is irritated because the urine is concentrated, it makes the bladder contract to want to get rid of it. So I think the main thing is to remember your pelvic floor is a muscle and it must be exercised like all the muscles in our body. There are specific exercises which Nigel and Kirsty have spoken about, but all that incidental exercise can help strengthen all of your muscles and just help keep everything where it should be and working as it should be. So I think the thing to remember is the pads cannot be detected under clothes. They're very thin. They're very tailored to the male anatomy. So I guess we say, it will protect you from your leaks, and we really want you to go out there and live your best life, because quality of life is what this is all about. And so definitely do not give up on the exercise, but just have a look at, again, how much you might be leaking and what product might be best to help you just to keep going out there and living your best life.
Brilliant. And Kirsty, would you add anything to that from Karen's response?
I'd agree with what Karen said. Often men who call through to our telenursing service want to talk through their experience with urinary incontinence and are often looking for tips and tricks. And so what Karen's touched on is certainly the types of things that we would mention and discuss. And often they also want to know is what they're experiencing a normal part of recovery after treatment. Am I doing the right things? What else can I do to help? And it gives them the best chance of regaining their continence. Absolutely.
Yeah, I think it's important too to touch on that and some of the misconceptions out there, because it can be, as many of us listening would know, you're faced with the diagnosis of cancer. There's a lot of information. There's a lot of unknowns. It's difficult to kind of sort fact from fiction in that sense too. Karen, I'm not sure if you have data or some specific examples on misconceptions and what might be helpful for men faced with this.
Yeah, absolutely. I think the biggest misconception is that it's only me. No one else is experiencing this. We do have stats to say 44% of men say they do not know anyone with bladder leakage. Guarantee they do. They're just not talking about it. And 33% say they don't have anyone to talk about the condition. So it's kind of a self-fulfilling prophecy. If you don't feel you have anyone to talk to about it, you're not sharing that with anybody else. And so everyone thinks nobody else has this. But it actually might surprise you to find that 1 in 10 men do experience leakage. So it is definitely more common than what is discussed. And it's the same with women. Women don't discuss it as either, but they do discuss it more than men do. But it is, as I said before, it's difficult for men. You're not used to wearing pads like women are. And there are some misconceptions that pads are only designed for women, that maybe they'll smell and that they're bulky. And maybe some might feel that you can wear your partner's feminine protecting pads, depending, of course, on your partner's age as to whether she's still menstruating. But I can tell you these pads are not designed to absorb the faster, thinner flow of urine, and they will not protect you. But they're also not designed to fit your anatomy. So as you've learnt today, we do have a range that is specifically made for the male anatomy, and they have technology built in that ensures that fluid is locked away, as well as the odour. And that's, I guess, the other misconception is that, there will be a lot of odour. The odour only appears if it's allowed to hit the air, because that's when bacteria grow. So if it's locked away in the pad, it will lock away the odour as well. But importantly, it will keep your skin dry to ensure that you don't have any skin irritations from urine sitting on the skin, because that's also, if it's not locked away and sits on the skin, it will burn the skin. So as I mentioned before, the lighter products, they're not big and bulky. They can fit in your back pocket, and it will just look like there's a wallet in your pocket. So it's, I guess, the biggest misconceptions, to summarise it, is that it is quite prevalent. There are other people who have the same issue, and the best thing to do is talk about it. You'd be surprised. My dad's quite open about it now, and he actually, if he hasn't been wearing a product, he might go, he lives in a retirement village, he might go to happy hour and he'll go, oh, I've had a leak. I'm just going to go home and change. And nobody's laughing at him. Nobody's anything. They just go, yep, no worries. And I've even been to his village to give everyone a talk about incontinence, and they loved it because they really need this information.
You're absolutely right. I mean, that's the cruciality of us having this webinar and this open discussion about it. And I think why we're able to be so detailed and give this advice to men listening who may not know how to start that conversation in some cases as well. Nigel, you touched on it before, your mental health experience and maybe some of those misconceptions added to the mental health side of it for you. Talk us through maybe what the impacts were just through that, the emotional as well as the on top of, I guess, the physical experience that you had.
I was very fortunate because I had a good mate of mine who got prostate cancer about 7 years ago, and his was aggressive, so his was taken out straight away. And he guided me through what was going to happen before and after, and that I had to wear pads, etc. So I was actually mentally prepared for it, thank you to him. But as it's mentioned on here today, there's a lot of men out there who don't get that same guidance that I did, and which is a bit unfortunate. But at the start, when I started wearing the pads, I didn't know how to react because at first I was going through 3 pads and at worst going through 4. But the good thing about those pads was, as mentioned, is they didn't leak. They're good. They're very good fitting. They didn't smell, and I just knew that I knew when I had to replace it because it got to a point where it was feeling a bit heavy, so I better go replace it. As a PCFA volunteer, part of the workshops I'm doing now is getting that message across to men that it's okay to have leakage and have pads. It doesn't define who you are. It's just an unfortunate byproduct of having your prostate removed. And it's okay, you can talk about it. It's okay to talk about it. As I said, it's so fortunate what I had is a good mate who I had to talk about it with. And that's what I'm trying to get the message across to other men when I do these workshops, is it's okay to speak to each other about this.
Oh, yeah. What experience do you have in the workshops? Do you feel like men are relieved perhaps in a way that, someone is speaking what they've felt and they have a safe place to talk about it. They feel more confident to bring it up in other situations. What's been your personal experience through the great work that you're doing, volunteering?
Thank you. Most of the talks I do at the men's sheds, and they're a great bunch of guys, and they talk about virtually anything. And they're actually shocked the amount of people who do get prostate cancer. I did a talk yesterday and talked about how many men per day get diagnosed, and they were shocked. And that's why we were trying to get the message across to them is it's okay if you're diagnosed. It's not the end of the world. We can guide you through this, including pre and post operation and wearing pads and being mentally prepared for it and things like that. And I find the feedback I'm getting from these men, especially the men's sheds, is so overwhelming, and they're so welcoming too, because they didn't know all these facts and figures that we're giving out to them, which is so good. So the feedback's been enormous.
This is amazing. This is reassuring, the fact that this message is getting out there to men, but people are feeling more relieved, more confident to talk about these things, to support each other through it as well. And I wonder, Kirsty, if we turn to you now on the nursing front, in terms of your experience through the telenursing, are there other stresses that you hear about that perhaps we haven't touched on, or on that emotional side, some points that you've experienced that many men face?
Yeah, certainly. A lot of men call through and with the situation similar to what Nigel described, in that they don't have anybody else to talk to. And so they just want to touch base with their experience and what they've been doing, and is this the right thing, and what should I do? What could I do better to improve my continence? Just to, I guess, have a little bit of reassurance in that they're on the right track and that they're improving. For some men, dealing with the changes to lifestyle and incontinence, it can be very difficult to adjust to, both physically and mentally. The incontinence can be highly distressing. And in those circumstances, our PCFA counselling team are available to support men with the psychological and emotional impact and help them manage how they're coping with these changes. And accessing the service is as easy as calling our telenursing team or going via our website and completing a self-referral. And there's no cost to the short-term service. So for those men who are really, really struggling with the emotional and psychological impacts of it, that's an excellent option for them to get some help.
And there's a very important day around the corner too, June 19. Talk us through this day, how people can get in touch with PCFA and get this support.
Yeah, certainly. So the PCFA are having a National Continence Call-In Day on the 19th of June, where men can call in to discuss any issues that they might be experiencing with incontinence. Of course, they can call us at any stage on the PCFA telenursing line if they do have any questions or queries in relation to incontinence or for any other issue that they may have.
Excellent. So that's June 19 that you can call in and get some advice. We do have questions too for our panel from the PCFA broader network, which is wonderful on this webinar that we've been able to have some questions that have been already sent through to us from the people and patients and family members affected by prostate cancer. So we'll take one for Karen first. What are some of the ways that the TENA pads differ from other brands?
The range stands out due to its secure absorption zone. And obviously our discreet design and tailored to fit for men. There are other really good products out there, not to pretend there isn't, but we have that really contoured design to the male anatomy, and we have what we call triple protection against the leaks, odour and the moisture, definitely keeping people dry, a lot more confident to actually step outside again and know that you are going to be dry. The big difference is we are actually available everywhere. So supermarkets, pharmacies, through distributors, they're actually widely available and usually the whole range. And that's really important to be able to find them wherever you can. There's also a variety of options. So it includes those really small guards and the black pad that I'm very confident we're the only ones that have a black small pad. And boxes for the light legs, and also that washable underwear, which just makes you feel like you haven't had to change your life. You're still wearing boxes if that's what you're used to wearing, but they are washable. The big thing is breathable materials that promote skin health and reduce irritation. So if you haven't got, we all know our skin needs to breathe. You don't want to be wearing a plastic bag. Because that will actually increase the moisture levels. It creates what we will call a microclimate. And so these products help breathe. I highly recommend don't do what my uncle did. He used to wear his underwear and then the pull-up pants I gave him over the top. I'm like, no, that's not the right way to wear it, because again, you don't have the absorption and you definitely don't have that breathability. But I think most men wouldn't do that. But yeah, it's all about the design and definitely locking away. And as Nigel says, and I'm really, very proud to hear him speak about the products. If you get that right absorbency, they don't leak, there's no odour, and you feel quite comfortable and confident.
And you're correct. This is talking about exactly the quality of life and how important that is, that, you can return to a sense of normality as well with these practical support and practical tools. Nigel, would you like to add anything?
Yeah, I was wearing the pads up to 6 months after surgery, and I wasn't allowed to do any sport or any running up to 4 months after surgery. So I was when I started running again, I was actually running with the pads, and I didn't even notice them when I was running. I was so comfortable. And even if I was leaking while I was running, I didn't even notice until it's finished. And at the start, I was wearing the thicker pads, and as time progressed, I got to the thinner ones until I got to a very thin strip. And that was terrific. And most of the time, I didn't even notice I had them on, especially if I was walking, or I was playing squash as well. I didn't even notice it while I was playing. So terrific product, and it surprised me when I started looking for pads that I went to the local chemist and only the TENA products were there, which surprised me in the end. So I think that says it all how good they are.
Running too, Nigel, I was going to say, but you've achieved half marathon status, so I think that
Wow.
yes, you've done a wonderful job. But I mean, that's
Thank you.
important too. Being able to kind of build the stamina and get back to more heavy exercise, or, these types of activities you really enjoy, and you can do that with confidence too, which is really important.
Yes, absolutely.
Yes.
Absolutely. It's a key point. We also have a question about payment schemes. So for Kirsty, are there payment schemes to support the purchase of pads? Who can help men understand their eligibility for these different schemes?
Yeah, sure. So men with severe incontinence might be eligible for a federal government payment called CAPS, or the Continence Aid Payment Scheme. And this can help with some of the cost of continence products. There are eligibility criteria that need to be met, including an assessment of your continence by a trained health professional or GP. And those specialists and nursing staff would be able to support with accessing this CAPS scheme. In addition, some states have their own schemes, and all of these schemes differ slightly. So if you need help navigating access or understanding CAPS and state-based schemes in your own personal situation, please give the Prostate Cancer Foundation of Australia telenursing team a call, and we can help direct you and possibly find a specialist to help you with the assessment.
Absolutely. We have a great question from our network too, because the focus often is on urinary incontinence. But we have a question about bowel leakage. Are there solutions for men that may experience bowel leakage after treatment?
Yeah, sure. Although less common, bowel leakage can be very distressing for men to experience after prostate cancer treatments. And just like urinary incontinence, pads and pelvic floor exercises can be a really helpful and good first step for management of bowel leakage. Making some changes to the diet by choosing foods to make bowel actions firmer and less frequent, and avoiding the foods that can make bowel actions softer and more frequent, can help some men gain some better control. There's also medications and stool bulking agents that can assist with making bowel actions pass firmer, slower, and reduce that leakage. And just like urinary incontinence, bowel leakage can be really highly distressing for some men, and sometimes can be difficult to talk about with those around you, the stigma that's associated with it. And in these situations, I encourage men to give us a call in the telenursing team for further advice and guidance on where to turn.
This has been a really important conversation to open up, not only as we've talked about, the side effects, the experience after surgery, the physical side, but also the emotional health and well-being in terms of incontinence. Let's do closing statements. Nigel, I see your head nodding along. What final words do you have for men listening, families listening about this issue, and how they can get support?
I think the key is just to talk to someone. If men don't have anyone to talk to, just bring the telenursing number. They're always happy to assist. Like myself, I had a friend to talk to. He warned me what was coming, what to prepare for before and after surgery, and I thank him forever for doing that. The other thing I'd have mentioned is we have community groups spread throughout Victoria and Australia, and I'm a member of the Morwell community group down there. And these groups are so important because it's men who may have cancer or just had the surgery or going through treatment, where we can just sit down and talk to each other, talk about our feelings, or what to expect, and everyone's there for each other. And I think a lot of men don't realise that these community groups exist. So that's why it's very important to get that message across, especially with the workshops I'm doing, because a lot of men I talk to don't realise they exist. So they're so grateful that now they have another option to choose, is to join one of these groups and talk about their feelings, their fears, and get rid of all these myths that flying around, well, especially on Dr. Google. And that's very important. The men have got to talk to other men, whether it's in person, whether it's mate, colleague, family member, joining one of these community groups, or the 1-800 telenursing hotline.
Absolutely. Karen, over to you. Closing statements and what you'd like men to take away from listening to our webinar today.
Yeah, look, definitely echo Nigel's statements of find somebody to talk to, whether it be a friend or whether it be the Prostate Cancer Foundation helpline. There's also a helpline with the Continence Health Australia, which is 1-800 33 0066, so they can give you some specific continence advice. But also, if you would like to reach out to us for specific product advice, we can help you with that as well. And we can also provide you with samples, because it is very tricky to you're looking at all these products and going, I know what she said, but I still don't know where to start. And so you can ring our helpline, which is 1-800-623-347, and we can send you out a couple of samples that you can get started. Unfortunately, we can't send samples of the washable. They're just a little bit too expensive for giving away for free, but the absorbent products, we can definitely send you out some samples. You can try them for yourself, and then we can advise as to where you can buy them.
That's brilliant. And I think, as we've said and reiterated many times, it's really important for men to feel comfortable and to have that ability, not only the accessibility to the products, but able to try them out and feel confident as well. Kirsty, over to you in terms of last messages for men and families listening.
Look, essentially, I'm going to exactly echo Nigel and Karen's comments. It's not a journey that you have to travel on alone, and having a network, and the network can include many different people of support that you can through this journey. Family, friends, support groups, peers, PCFA telenursing and counselling team, specialist nurses for continence and prostate cancer specialist nurses at treating hospitals, pelvic physiotherapists, GPs, urologists. There's so many people out there who you can turn to help, so you do not have to journey this alone. Reach out, and not to forget about the call-in day on the 19th, giving us a call if there's any questions or concerns, or sooner if needed, on the 19th of June between 9 a.m. and 5 p.m. Australian Eastern Standard Time on our 1-800 number, 1-800-22-0099.
Brilliant. You took it away with the final message that we needed to hear. So Thursday, 19th of June, again, that number is 1-800-22-0099 for the Continence Call-In Day. But a very important discussion today. Again, if you've been listening or watching our webinar, you can send it to a friend in need or a family member. Regaining confidence by improving continence. Thank you so much to all of our expert panel. Again, you can find out more details about PCFA, the range of support available at pcfa.org.au or prostate.org.au. Thank you all, and we'll see you again next time.